evening. We're now live. It's 7 o'clock Tuesday night. So this is the time of evening where we have some Q's and A's. I've got, before I forget, I've got one on the Instagram sticker. Always delighted to get them on the sticker. I think it's on the sticker or somehow on the Instagram post. So I'm going to do that one first before I forget, because I haven't got the titles on that on the Facebook. So that was, how can you make a surgical scar heal stroke fade faster? So I guess there's two aspects to that question. One is the healing aspect of it, and the other is the fading aspect of it. So Jackie's in the house. So the healing of a surgical scar is something that we as plastic surgeons work hard to try and perfect. I think, well, I was about to say I think all surgeons do this, but I'm not sure if they do actually, because a lot of plastic surgery training is revolves around suturing and techniques for suturing, whereas I think a lot of other surgical specialties spend a lot of time on other aspects of the surgery. A large proportion of plastic surgery operations really is suturing the skin. If you think about a lot of the operations we do, certainly the body contouring, cosmetic type operations, a lot of it is a large part of the surgery is skin closure, which, you know, people wonder why, you know, they have a bowel surgery or something, the scar's not very good. Well, it's not the priority of the surgeon is not the scar, it's to sort out the bowel and to make sure it all, you know, all works properly, which is reasonable. So yeah, so a lot of what we do as plastic surgeons involves around suturing the skin and closing the skin and getting a good skin closure. So that's important to make sure the skin heals. So we will often try and ensure there's not tension on the wound. So we try and orientate the wound so it's in the line of least tension, and take the tension off the wound by putting some deeper stitches in. Sometimes I think we've got a question later on about having dissolvable stitches on the face, which we'll talk about deep stitches, because the face is one of those areas where personally I tend not to put deep stitches, but often in other areas you'll put deep stitches in, so before you even put the skin stitch in, the wound is looking pretty well closed. So taking the tension off the wound is one thing to help the wound heal properly. And then one of the things we try and do when we're putting the stitches in is to evert the skin edges so they're effaced properly. If they're inverted, if it's epidermis to epidermis, skin edge to skin edge, when you take those stitches out, then the wound will open up. And so so you need to have good contact with the skin edges, and so that means everting the edges to try and make it heal better. Hi, Noah Surgical. Can you make a business relation with me? I'm not really a business to business guy, Noah Surgical. I'm a supplier of surgical instruments. Okay. Yeah, no, I'm no, a Vicky Noah at the clinic. It does all the instrument stuff. It's not me, Noah. I don't sort of order the instruments and what have you. So yeah, so you want to evert the edges, get good to get good wound healing on the wound to ensure that the wound heals. So trying not to traumatize the skin as well, so minimizing how much you handle it with the forceps and with the instruments. So these are things that are good to tissue handling to try and make the wound heal better and more quickly, make it fade more quickly. The best thing to make a scar fade is time. Time is the number one thing, and most scars fade pretty well given enough time, and that probably means upwards of a year really for it to properly fade. You know, a year is kind of where you really get proper fading going on. The first few weeks and months it's often quite red, and it can take a long time. You know, sometimes scars even at 6-8 months still got a bit of redness to them, and they will continue to fade over time. So time's the number one thing. But there are other things you can do. For me, the mainstay of scar management involves around moisturizing and massaging. And I normally do that once the wound's healed. So about 6 weeks, we get you moisturizing and massaging the scar to help break down the scar tissue. So that's the mainstay of treatment of scar management in my practice. There are other things you can do. But usually, and in my practice, they are reserved for problematic scars. So problem scars being red, raised, lumpy scars. So if you do have a problem scar, there are other things like silicone sheets or gels, steroid injections, laser, There are these other modalities in order to manage problem scars, but the majority of cases are not problem scars. They're just red scars. They're just inflamed scars. They're not inflamed, just red and active and firm. So moisturizer, massage and time is the main things for it to fade. While it's fading and while it's red, you've got to be really careful not to get sun on it. So if you get sun on a red scar, then you can, if you get a tan on it, it can keep the tan. So that's really important to maximize your scar. And stay healthy, fresh fruit and veg. Keep yourself healthy. I'm trying to wait this and water, good for your skin, things like that, which are good for your skin. But yeah, moisturize, massage after 6 weeks, and time are the main things for scars to fade. I think this one catches a lot of people out. Does a breast lift include an areola reduction? And I think it catches a lot of people out. The answer is yes. So a breast lift and a breast reduction, both of those operations involve reducing the skin envelope of the breast. That's where the lift comes in. So when you do a lift, you're just reducing the skin envelope of the breast, so you're keeping the volume the same. When you're doing a reduction, you're reducing the skin envelope of the breast and you're reducing some volume. So both those operations, a breast lift and a breast reduction, it removes skin from the breast to tighten the skin of the breast, and that includes the areola. And often the areola is a little bit big because of the skin of the breast has been stretched, and that includes the areola. So it's completely part of the procedure to do an areola reduction. You don't have to ask for it, and you certainly don't have to pay for it. It's an integral part of a breast lift / reduction. And reducing the size of the areola is part and parcel of the surgery, because the whole skin envelope is being reduced as the breast is either being tightened in a lift or tightened and free. That's a bit of a bit cryptic, isn't it? So FTM is female to male, so gender reassignment surgery. So the top would be the breast, so making a female look like a male, so removing the breast, removing the breast basically. So essentially the short answer is no, and the reason it's a no is because it's a specialist area. Gender reassignment surgery in general terms is a specialist area, requires an MDT, and it is not something that I do or I specialize in. And my colleague Guy Stern works in the area, and he has connections with MDTs and psychologists, etc. So he is the person I would refer to for that surgery. The actual doing of the surgery is quite similar, so it's kind of similar to sort of breast reduction, gynaecomastia sort of thing. Female to male, similarly male to female is kind of similar to breast reconstruction, breast augmentation. So the surgery is kind of similar, but they're all like with anything, there are nuances in it, and you always kind of want to see a specialist really because of those nuances, and you want to see someone who's doing it regularly. And I'm not doing it regularly, I'm not doing it at all. So it's just one of those things that's partitioned into certain surgeons have specialist interest in it, and I don't have that. So Guy used to do it in the NHS when I worked with him and had all the connections there, and so I think has sort of carried on doing it in the private sector, and that's kind of how it tends to work in the private sector. You have a special interest in the NHS, then you keep with that sort of thing in the private sector, keeping within your scope of practice. How long after having a mole removed can I go abroad? Well, flip the other way. People go abroad moments after having quite major surgery with these sort of cosmetic surgery tourism type individuals. So it can be done. Wouldn't advise it. But for a mole removal, not a big deal. Well, it's not a massive mole. So for mole removal, not a massive thing, but you can. The main thing I would ask to that is why you're going abroad. So if you have to go abroad, you could go abroad the day after your mole removal. So in fact, I have had a patient who was going abroad the day of their mole removal. They came on the way to the airport. True story. To have their mole removed. So you can have your mole removed on the day of your traveling. However, it is not recommended. I would not recommend it, simply because if you have a problem, if you have a bit of bleeding, if you have a bit of infection, if the scar's not right and you're abroad, it's just difficult. If you're in this country, it's quite easy. We say, look, get some antibiotics, we can phone your GP, or you can come to the clinic and give you a prescription, whatever. It's relatively easy to check on you, give you some dressings, give you some advice, have a look at the wound, etc., etc. It's difficult if you're abroad. So I would say, ideally speaking, you would wait, and sort of 4 to 6 weeks is the norm. Your scar will still be red, so you've got to be careful in the sun, particularly if it's on your face. So it'll probably be 3 to 6 months, maybe even longer, for the scar to fade. So the sun is one issue. But in terms of the healing and stuff, it'll be healed in a week or two. But I would say 4 to 6 weeks is kind of normal for that sort of thing. But as I say, I wouldn't over-egg it. And if you had to go abroad for an urgent requirement, then you would be fine to go abroad. Basically, it's just if you had a problem, it might just be a bit more complicated than if you're at home. So I wouldn't particularly advise it if you didn't have to for a month or so afterwards. Are dissolvable stitches used when having a cyst removed on the face? So this is a bit. So a minute ago I said we get good scars by taking the tension off, by often putting deep stitches in. The face is one of those areas where I personally don't use deep stitches. Some people do, and it's not necessarily wrong to use deep stitches, because, as I say, they can take the tension off the wound, which is good. The problem with deep stitches is that they can cause stitch abscesses, and they can cause inflammation while they're dissolving. So the deep stitches are or the dissolvable stitches are deep underneath the skin, and while they dissolve, they can make the scar more red. It'll get to the same point, but it just makes it a bit more red when they're dissolving. And sometimes you might have seen it in sort of bigger operations like breast reductions and tummy tucks. You see little dots and little bits where the stitch kind of spits out because the body says, I've had enough of it, so I've had it in for too long. So that's why personally I don't use stitches when having a cyst removed on your face, because the face tends to heal really well. So unless the skin's under a lot of tension, and for a cyst removal it shouldn't be really, because a cyst is a subcutaneous lesion, so there isn't really skin involved when you have a cyst removal. So you don't usually tend to remove much skin. Sometimes you need to remove a bit of skin if the cyst has tented up the skin and sort of stretched the skin. You don't want to have loads of baggy skin left, but you're literally just removing the skin just to make it sit flat. You don't have to remove skin in the same way you would if it was a cutaneous lesion like a mole or something like that, something in the skin. You're actually removing the skin is the surgery, but this is subcutaneous. So the point is that the wound won't be under quite as much tension as it would be if it was a cutaneous lesion, if it was a mole or something like that. And you're actually removing skin, it will be closed tighter. So that's, maybe people will be more inclined to think about dissolvable sutures in those circumstances. But a cyst, usually not, but not unheard of and not unreasonable. The problem with this sort of stuff is that I'm saying what I do. There are people out there who do use dissolvable sutures on the face for that very reason, to take the tension off. So there's pros and cons with it. As I say, I'm kind of more on the avoiding it if I can, but there's no answers to this stuff. It's all kind of opinion, but I wouldn't say it's as common, certainly not as common as other parts of the body. And the other, when thinking about it now, this question talking about the stitches in the skin to be removed? Because I'm talking about stitches underneath to take the tension off. So usually on the face, we use non-dissolvable sutures, which need to be removed a week later. Again, because the dissolvable ones go red, and also the dissolvable ones is unpredictable how long they'll take to dissolve. And if they take a bit longer to dissolve, you can get little dots at either side of the scar, forming what's called stitch marks. And so if you use non-dissolvable sutures, then you can say, look, come back in a week, come back in 5 days, we'll take those stitches out, and they're gone by then. So there's less risk of leaving stitch marks. So again, personally, I tend not to use dissolvable sutures in the skin to close the skin of the face. I use stitches that need to be removed. The only exception would be someone who's the scalp, where the stitch marks don't matter. Places like behind the ear, earlobe, I still use dissolvable stitches where it's quite fiddly and little stitch marks don't matter so much. But the other example would be children, or people who are really don't want to have the stitches removed for whatever reason. Then you can use dissolvable sutures on the face, but they do run the risk of potentially causing stitch marks and potentially causing a slightly more red scar than would have been used if non-dissolvable sutures would have been used. How long downtime is needed following cyst removal on the face? Another cyst removal on the face question. Not long. As I say, it's not usually under tension. You don't really need any downtime. You'll have a scar, so you don't want to bend and stoop and lift. If you involve lifting, or if you do any gym work, you don't want to put any heavy lifting on it because you don't want to increase the blood pressure in your face, basically, to make it bleed. So anything that makes your face go red. So if you bend over and pick something up and your face goes red, that's bad. So you want to avoid that for a couple of weeks. The wound will be healed in a week or so, 5 to 7 days. And you just don't want to get it dirty. So if you work on a building site, cover it up and maybe work in the office for a week or so. At a week, it should be pretty well healed. But I wouldn't necessarily say that's downtime. It's just depending on how you're feeling and what your work environment is. But you'll be able to sort of go about your normal daily work. I'd have thought. I mean, it depends. Assists and assists on some massive ones where you might have a few days off, but a normal one probably wouldn't need too much. Is it a common combination to have inverted nipples sometimes and a little bit of gynaecomastia? Not really, no. I mean, inverted nipples is less of a common issue with men, and obviously gynaecomastia is, by definition, with men. It's excess breast tissue in a male. So inverted nipples is more common in females because it's due to scarring and tethering of the milk ducts. So the short answer is no, it is not a common combination to have inverted nipples and a little bit of gynaecomastia. It would also be difficult to, because I'm thinking if I've ever done, I don't think I've ever done a gynaecomastia where I've corrected an inverted nipple, because I would be a bit anxious about correcting the inverted nipple at the time of the gynaecomastia, simply because the blood supply of the nipple, you're already going completely underneath the nipple when you do a gynaecomastia. So if it was shortened ducts, that should solve the problem, to be honest with you. But I wouldn't normally go directly into the nipple to do things because I worry about blood supply. So it's not a common problem. It may well be because we're taking all the tissue underneath the nipple away that it would revert itself. But I wouldn't be going into heavy to correct the inverted nipple specifically at the time of a gynecomastia, because I wouldn't want the blood supply of the nipple to be altered. Because when you do a gynecomastia, you make, or when I do it, I make a U-shaped incision on the areola, the base of the areola, and I wouldn't then want to go too much into the nipple to try and do things to potentially mess the blood supply up. So I would probably say to you, look, I will try and do my best to improve the inverted nipples, but my main focus would be the gynecomastia correction, assuming that's your main problem. I guess the flip side is if the inverted nipple is your main problem, you could have just a local anesthetic procedure to have the inverted nipple fixed, and then consider whether you wanted the gynecomastia later. So maybe doing them as a staged procedure. But if I had a choice of which way I would do the staging, I would do the gynecomastia first, because I say that may well improve the inverted nipple correction, although it couldn't be guaranteed. Whereas if you do the inverted nipple correction first, there's no way that's going to make the gynecomastia better. So that's kind of my rationale thinking on that. So yeah, I think that is a good slew. Use the word slew of questions there. If you do have any questions, then I'll be back next week. Got a suspicion we're into December next week, which is exciting. So yeah, I very much would look forward to your company then. And if you have any questions that I haven't covered, call me, message me, and I'll do it next week, because at the current time I've got nothing to talk about next week. So hopefully there will be something between now and then. So yeah, hopefully the advent calendars will be up by then. And thanks, Corin. How you doing? Some great questions. Thank you. Thumbs up to you too. And I will bid you good night and see you in 7 short days' time. Thumbs up. And the